Cognitive Behavioral Therapy by Olaide Akinyinka. Introduction. Cognitive behavioral therapy is a system of treatment involving a focused thinking and its influence on both behavior and feelings. It's one of the dominant approaches to psychotherapy, basically called CBT. It's based on a model of psychopathology that emphasizes the role of dysfunctional beliefs and situational cognitions and their influence on emotional and behavioral outcomes, which in turn reinforce negative beliefs and thought patterns, according to Cognitive Behavioral Therapy Strategies 2018. Cognitive behavioral therapy treats the client as a person whose maladaptive thinking has led to changes in their emotions and behavior, Beck and Beck 2011. These changes affect the relationship that the clients have with themselves and others. The goal of CBT is to see beyond the diagnosis and look at the person as a whole to decide what needs to be fixed. Kaplan and Kakuzo 2013. CBT is based on an ever-evolving formulation of patients' problems and individual conceptualization of each patient in cognitive terms. CBT requires a sound therapeutic alliance. It emphasizes collaboration and active participation. The goal of the therapy is patient-oriented and problem-focused. CBT was pioneered by Dr. Beck, a psychiatrist at the University of Pennsylvania in the 1960s. He was originally practicing psychoanalysis but later designed and carried out several experiments to test psychoanalytic concepts on depression. To his surprise, the experimental results left the psychoanalytic fundamental concepts invalid. The first intentional therapeutic approach to distance itself from psychoanalysis was rational emotive therapy, which was originated by Dr. Albert Ellis. This approach was found to be inefficient and non-directive in nature. Key figures. Dr. Beck graduated from Brown University in 1942 and Yale Medical School in 1945. He was initially trained as a psychoanalyst, and his exploration in the field led to development of CBT. He founded the Beck's Institute for Cognitive Behavioral Therapy, a non-profit organization in 1994, which is an extension of Beck Center for CBT. He used this new concept to help patients identify and evaluate their automatic thoughts to allow patients to think more realistically. According to Baraka 2012, Dr. Beck has published over 540 articles and co-authored over 22 books. He participated on review panels for National Institute of Mental Health and has been visiting scientist on the Medical Research Council at Oxford University. He has also been a visiting professor at Columbia, Yale, and Harvard University. Beck's model of depression. There are three negative triads for depression, according to Beck in 1979. Negative view of self, negative view of the world, and negative view of the future. The key terms: cognitive formulation, conceptualization, cognitive model, and automatic thoughts. Target population. CBT is indicated in the treatment of many psychiatric mental health disorders, such as depression, anxiety, eating disorders, substance abuse, personality disorders, and along with pharmacological intervention. It can be used also in treatment of bipolar and schizophrenia. It can be effective in treatment of medical disorders as well, which include the chronic fatigue, chronic and acute pain, premenstrual syndrome, sleep disorders, colitis, and obesity. Assessment and DSM-5 conditions for CBT. Panic disorders, PTSD, generalized anxiety disorder, depression, schizophrenia, amongst others. A case study. This is about a patient that has been having issues and has tried several treatments before going for CBT. He's a 30-year-old Caucasian male that was diagnosed with bipolar type 1 with major depression with psychotic features. Also has GAD and alcohol dependency. He was in the hospital for 3 days. He had panic episodes, impaired sleep, loss of libido, impaired appetite, weight loss, withdrawal, amongst others. He reported high energy in the past, increased productivity, purchasing 2 vehicles just for the hell of it, mild grandiose thought, impaired frustration tolerance, irritability, and impulsivity. And recently, before the hospitalization, he was paranoid, started drinking a lot, trying to make that to help him relax. And during the hospitalization, he had symptoms of alcohol withdrawal with diaphoresis, which resolved 24 hours after admission. He's been hospitalized before for suicidal attempt. He has been on Celexa 20 mg daily, Trilepta 300 BID, and Clonopin 1 mg BID. His past medical history consists of asthma and tonsillectomy at age 12. He reported been drinking for the past 2 days and smoked half a pack of cigarettes on a daily basis. Family history of bipolar disorder from his mother and his maternal grandmother. His speech is normal, no psychomotor agitation. He described his mood as depressed and feeling worthless. His affect is flat, but it was very congruent. He was very congruent with his mood. He is oriented to person, place, and time and situation. And during the assessment, he refused to engage in any activity. He refused to spell the word backward in series of 7s. His remote memory is intact, as evidenced by recall of significant childhood events. He reported paranoid thoughts, suicidal ideation, and drinking. He also has auditory and visual hallucination, as well as tactile and olfactory hallucinations. He denied any obsessive compulsive behaviors, and he verbalized having problems with concentration. He demonstrated understanding of his psych condition and want necessary steps to achieve therapeutic results. Goals of psychotherapy. CBT is to help individuals achieve remission of their disorder and prevent a relapse. Beck 2011. Treatment approach, method, and practice. Initially, a strong therapeutic alliance must be established by the client and the provider. The goal of the treatment, the plan, and intervention should be discussed at the beginning of the therapy. The patient should be able to view the provider as a team member to achieve the same goal. According to Beck in 2011, validity of the patient's thought and belief must be at the beginning of therapy. The patient is taught emotional regulation skills in CBT, and each treatment session is between 30 to 90 minutes, and response is often achieved between 6 to 12 sessions. CBT worksheets consist of alternative action formulation, functional analysis, longitudinal formulation, dysfunctional thought record, factor opinion, cognitive and attaches a video of a patient in CBT therapy. Review of evidence for CBT is as follows. There was a study done by Reisvan et al. In 2018 that showed the effectiveness of CBT in treatment of GARD and concluded that CBT is as effective as treatment with combination of interpersonal therapy. The same study was explained by the patient. Tarkington and Kingdom Wading stated that utilization of CBT in treatment of schizophrenia has enormous strength of evidence that supports its effectiveness and also suggests psychotherapy techniques should be widely used in the US. Randomized study by Amir and Zoraida in 2014 concluded that effectiveness of addiction with CBT and psychotherapy in depression was clearly depicted. Professional organizations are listed: Beck Institute, Clinical Practice of Cognitive Therapy, CBT for Psychodynamic Professionals, CBT of Staten Island, New York Cognitive Therapy, amongst others. Conclusion: cognitive behavior therapy is a form of therapy that has been empirically studied and shown successful with conditions. Cognitive therapy is merged with behavioral therapy in order for a person to first recognize and take captive of their maladaptive thoughts, create their adaptive thoughts, and change their behavior accordingly. Its success rate being as good or better than medication alone inclines to be a highly sought after model to treat various disorders. The concise nature of therapy using CBT is due to its action and goal-oriented executions. Therapists and clients collaborate equally in executing effective techniques through assignments which challenges the client's thinking and acting in daily life. Although CBT is equally effective in treating disorders in which medication alone is successful, but conjoining the therapy may give the client a certain disorder the greatest relief. The reference is listed. Also, the study guide, which shows a step-by-step method of identifying the negative thinking and replacing it with healthier thinking. How to recognize the inner dialogue. The studies have shown that CBT is effective at treating anxiety, depression, and addiction in many life challenges. The worksheets are